I just want to take you back a couple of years to the beginning of the Obama administration, when at the time it seemed that all of our eyes were focused on unemployment. It's not to say that we're not focused on that today. It's not to say that joblessness is not a concern today. Of course it is. But at the time it seemed to be issue number one. You may recall that Rahm Emanuel, now the mayor of Chicago, was the chief of staff for President Obama at the time. He was quoted as saying, "Never waste a serious crisis." His concern was, should the government bail out the largest corporations in the land? How do we get the citizenry back to work? Who knew? Before too long, issue number one would be health care in this country. Who knew how contentious that was going to be at that point? Whether it was going to be socialized or privatized. Who knew, as people began to make the comparisons with healthcare systems in other countries and how we deliver quality health services at an affordable price, that would become so contentious and would be on everyone's mind, push virtually everything else aside. An issue as complex as healthcare is not something that we are going to solve here tonight, and it's not something that we're all going to agree on here tonight. But one thing I think we can agree is that this is an issue that has created and generated a tremendous amount of heat in very, very little light. Tonight, we're hoping that our experts will identify for us and help us walk through some of the major issues in healthcare. And we have three panelists, distinguished panelists, with us tonight who are experts in that area.
I'm Winky Wong. I'm an associate professor from Pennsylvania State University.
I'm Dennis Felding, president of Keystone Human Services.
Good evening. I'm Dr. Sarah Norbash. I'm the medical director at Messiah Village.
Dr. Winky Wong.
Taiwan, very small countries, 130 miles off south of China. If we compare their healthcare spending with the U.S., 6% of their GDP in healthcare compared to U.S., 17%. And healthcare costs in Taiwan is about $1,800 per year per person compared to U.S., it's about $7,500. And why I wanted to talk about Taiwan National Health Insurance System, which launched in about 1995. Because prior to 1995, the society has a big problem. It has about more than 40% of our population that are uninsured, and the remaining insured population was much like what we have today. It's scattered around many different insurance programs. And in earlier 1990, both the ruling political parties and the opposition political party recognized that it has become a political necessity for them to engage in health reform. They formed a task force. They call it a study group, but in the U.S. we call it a task force. They formed a task force to study different models around the world. One unique nature about this task force is led by academia. It's university professors and so on. And they travel around 40 different countries. The objectives for them is to learn how other countries are doing and what's the problem or the challenge and advantages and disadvantages that they are experiencing. And after 18 months of a very, very intensive debate, and when I talk about intensive debate in Asian language, that means sometimes, occasionally, fist fight in the parliament, and it's very, very intensive. Protests and political commentaries and talk shows and everything that you can think of. It's a heated debate all the time. Why do I want to bring up that experience? It's pretty similar to what we are seeing right now. So a couple months later, after that law is passed, that the Bureau of National Health Insurance was established. And 2 months later, they launched a very, very ambitious program called National Health Insurance Program. When we are looking at socialized versus privatized, does that even make sense for us to focus on these two spectrums and forget about a lot of the things in between? So, in the end, when everything is said and done, they come back and look at the program that they just established. It actually looks like the U.S. Medicare program. Immediately after that launch of the National Health Insurance Program, the intensive protests from the providers and medical community, there's a lot of confusion and chaos. There's a lot of concern over the immediate shortage of healthcare providers, and there are a lot of concern about whether or not this expansion would hurt the quality of care of the countries, and they are not certain if the nation can actually afford this healthcare for all idea. No strange to what we are thinking and hearing today. 2 years later, about 99% of the population were covered by the insurance program, by NHI, by National Health Insurance Program. When I ask 99%, now what is the 1%? The Deputy Minister of the Health Department look at me and say, 1%, you are the 1%. I said, what do you mean? He said, because you travel from the United States to Taiwan, if you stay here for more than 3 months, we have to cover you. And that's the 1%. So satisfaction went up initially 39% to all the way to 80%. It covered a very broad array of the services, almost anything that you can think of. Inpatient, outpatient labs and prescription, dental and vision, or home health, and even the Chinese alternative medicines. How does it finance the program? It basically was shared responsibility. Typically, employer pays 60%, individual 30%, and government 10%. Low income is a subsidy. It has a very high satisfaction rates. It basically eliminates the quote-unquote medical pool. And no one has declared bankruptcy due to a medical cost over the high medical costs. In the U.S., the bankruptcy, personal bankruptcy, is 62% is due to medical costs. So that's a little bit background. So no one would retain their job because they are afraid of losing their insurance coverage by changing job. So as the Taiwanese achieved this healthcare system through a redesign, they challenged a couple of thinkings. And one of them is that the notion of socialized and privatized. And the reason why this has been a difficult concept for them to grasp is that they don't know if it actually makes sense to think about privatized and socialized. Because 85% of hospitals in Taiwan, 98% of clinics, 70% of hospital beds are privately owned. And they create a program, in our language, we call it socialized medicine. They don't understand that. So if I look at a global view, and there are many different healthcare models that we can put all over the map. So how do we put our United States in this map? We have VA and military, basically it's a Britain model. We have Medicare, basically it's a Canada model. We have employer-based, basically it's a Germany model. We have uninsured, that's basically is this, you are on your own model. So in light of this, when we talk about socialized and privatized model, I don't know where we are, but I can tell you this, that the biggest consequence that we are suffering today is not the ideology difference. I think the worst consequence we are suffering today and we are enjoying today is because of this, we are creating a very fragmented healthcare system. Our left hand and our right hand are not coordinated.